What is up, everyone? Welcome back to my channel. If you are new here, thank you so much for stopping by. My name is Lori. I'm a family nurse practitioner. On my channel I talk nursing and also do a little bit of health and fitness. If you are not new, thank you so much for coming back. Make sure you guys are subscribed before you leave. So in today's video, I'm going to be sharing with you guys what is in my work bag and also some nurse practitioner essential that I think you'll be interested in if you are a newer nurse practitioner just starting out. If you guys are new to my channel, I work primarily in the nursing home setting and I also do wound care. So there's certain things that I bring with me every single day, especially in the nursing home setting, because when I tell you it's dry in a lot of these nursing homes and I cannot find some of the tools that I need to do my job. So I pretty much just walk with everything when I'm working. When I'm at the hospital, of course not, because the hospital tend to have everything that you need. So this is my work bag. This is the Tory Burch, I think it's a Tory Burch Ella bag, and it's the larger version. There is a smaller version of this bag, but I chose to go with the larger one. Now, it has two pockets on the inside and it doesn't have any more pockets. So if you're someone who likes a lot of compartments in your bag, I don't think you're gonna really like this bag that much. It also only has a clamp on the front and two buttons at the side. So it doesn't have a zipper. That is my only negative about this bag, is the fact that it doesn't have a zipper. I wish it had a zipper on top so you could just zip it up and be done with it, but it doesn't have a zipper. Nonetheless, I like it because of the size. It can pretty much hold everything, and also it is patent leather and nylon, so I can clean it. I actually wipe this down with Clorox wipes all the time when I use it, and it's been fine so far. So the first item that's in my work bag is my computer, my laptop. I take my computer with me every single day because when you're a lot of times when you're in these nursing home settings, there's not a lot of computers for you to work on and to do your notes. My laptop was actually provided by my boss, so I did not have to provide my own laptop. The next item that I have in my work bag is this little, it's like a clipboard on front and a notepad in the middle with also this compartment. So I like it because it has the little compartments inside, and in these compartments I actually have my billing sheets. So this is what my billing sheets look like. I don't do my own billing. Only thing I do, I write the patient's name down, date when they were admitted, room number, and the level of service that I was billing for that day, and also ICD-10 codes. Now, if you're a newer nurse practitioner, ICD-10 codes is something that you're gonna have to be familiar with. Every diagnosis has a ICD-10 code, and that is what you're going to write down when you are billing. So say for instance your patient is diabetic, and for me, so diabetes is E11.9. When I was newer, I would Google ICD-10 codes and the biller would let me know that it was missing like a letter or a number or something. So there is a ICD-10 code app. I'm going to record my screen and kind of show it to you guys. I didn't know anything about this app when I was a new NP. My boss actually told me about this app. So you pretty much, this is what it looks like. You type any diagnoses in here and it'll give you an ICD-10 code. So like I was saying, my patient is diabetic but also has a foot ulcer. They have a diabetic ulcer. I would just type in diabetes and probably foot, and it'll populate diabetes type 2 with foot ulcer, and this will be my ICD-10 code for the patient. So this is a pretty good app if you're a newer NP. The next thing that I have in my work bag, of course, is my trusted stethoscope. So this is the Cardiology 3 stethoscope. I really like this. I like to put bags inside of my bag, and this is just one of those little bags that I throw in here. Inside of this bag I have just like my girly stuff, you know, like in here I have like my tampon, I have my gum, of course, hand lotion, hand sanitizer, and lip gloss. Oh, I also have floss. Do you guys walk with floss? Because guess what? I sure do. You never know when you will need a floss. So the next item inside of my bag is my pen case. You know, us nurses and our pens, we're pen hoarders. I think I have 20 pen cases, and every time I buy a new one, it matched my stethoscope a little bit because the diaphragm and the thing is rainbow. So the next things that I have a couple of essentials that I walk with. When I was a student, I purchased this. It is a antibiotic antibiotic coverage type reference list. It's like a quick reference list, and I got it from APEA. When I was newer, of course, now that you're a practitioner, you're prescribing stuff, kind of have to know antibiotics and different things like that. And I thought this was a great reference. I still walk with it. It tells you what group of antibiotics cover what organism. So if it's a gram negative or a gram positive, it tells you which antibiotics would be better to cover those things. The next little pocket guide that I have is this one. Now this is actually a medication pocket guide, and this is the updated version. I think this is the 2020 version, and I like this because it breaks it up by system and gives you different medication by different system, and also the different dosage that it comes in, which is nice. Now this little book here, this is actually a notebook that helps you when you're doing your progress note. Now I have not used this yet. I just bought this because one of the girls that I follow on Instagram story, she was showing this book. I think I was saying in one of my other videos about progress notes. I don't know how I didn't know about this book. When I looked at it, it really go into how you're supposed to kind of set up your progress note, which is pretty awesome, so you don't miss anything in any system, and how to kind of go from head to toe. The next thing that I do carry with me in my work bag is, of course, my prescription pads. I'm not gonna open them up because we all know what a prescription pad looks like inside. So in the nursing home setting, when patients are being discharged, I have to give them a 30-day supply of their medication when they're going home or wherever they're going. If it's a controlled substance like Norco or something, I give like a 3-day supply of that. You only give them a 30-day supply because the thought is they're supposed to follow up with their primary care physician within that 30 days. Now the next thing that I have in my work bag is my holy grail that I take with me every single day, and this little bag house all my tools that I need for this job. Now this little bag here, I only paid $5 for this bag, believe it or not. I found it at Target, and this is the inside of it. It holds everything that I need it to hold. So first thing in here, I have this flashlight. I do wound care, so when I'm looking at my wounds, I need to kind of see the crevices and the corners properly. Then I have my pen light. This is, we all know what the pen light does when I'm assessing my patient. So I have a pen light in here. Telling you, these nursing homes hardly have anything. And when I started out, I realized you're gonna have to walk with your own things, because half the time things are broken and half the things that they don't have, and I just could not be bothered anymore. So then I have my pulse ox. I have my own otoscope. I walk with this. When I first started, I would get nurses all the time that would tell me, this patient's complaining of earache, they're having ear pain, can you order antibiotic? Listen, I am not a practitioner that loves to throw antibiotics at patients all the time, because sometimes they don't need antibiotics. They keep telling me about ear problem, and sometimes I don't have an ear infection. Sometimes it's wax buildup. So I just started walking with my otoscope, and that was what was happening to a lot of these patients in the nursing home. They didn't have no ear infection, it was wax buildup. So this I walk with every single day. The next thing that I have in this little bag here is my blood pressure cuff. Now this is my blood pressure cuff, the manual blood pressure cuff, and the nursing homes have blood pressure machines. They have those Dynamap, and when I first started, I would get nurses sometimes that would give me an attitude if I asked them if they check the patient's blood pressure. I would get things like, there's no order for a blood pressure, and I would say, well, the patient is on metoprolol, so you're given metoprolol and you didn't check the blood pressure. It just blew my mind how they're saying there's no order to check a blood pressure, but you're giving patient digoxin. So even if I say what's the heart rate, they don't know. If I say what's the blood pressure, I don't know. So I would get that a lot, and I did not like it, and I would try to find the machines and I'm checking my own blood pressure, and I still check my own blood pressure to this day. I will use your Dynamap if it's available, and if I don't like what it reads, I check manually myself and go from there, because feel at the end of the day it's the right thing to do. So that's what I do. It makes more work for me, but it's the right thing to do, and that's why I check my own blood pressure. That is it, guys. That is all that I take with me in my work bag. Let me know in the comments down below what you take with you to work. Thank you guys again so much for watching, and don't forget to like, comment, and subscribe, and I'll catch you guys up in my next one. Bye, guys.